Good morning, everyone, and welcome back. So yesterday we had fantastic technical discussions on 4 of the themes, and today we're going to have a deep dive into risk communications. And I'll let the risk comms team give you an overview of that, but I just wanted to remind you of a few things. One, we said that we were going to be looking for your inputs, and today is that day. So there are several ways that we want to hear back from you. One, there is an online survey. This is the link to it. We will also send this to your emails. There are 2 surveys. There's one asking some questions, reflections around the priorities. What should we be focused on? What's important to you? And then there's an outcome evaluation of the overall forum. How has this gone? Did it meet your expectations? What should we do different next time? So if you can please fill out both of those. If you could kindly do the member survey first, maybe even by lunchtime. If we have enough responses by this afternoon, we'll try to give some collective numbers of the sense of how you all feel we should be shaping the network. We'd really appreciate that. If you've not signed up already for the site visits tomorrow, please do so. The sign-up sheets are out on the registration desks. And then there are a few other things happening today. We have some questions on the windows in the foyer with some sticky notes. So please answer those questions. Add your ideas to that group think of what we should know about is happening. There will also be some interviews happening down in the entry, the landing here. So if the team approaches you and you'd like to talk to them and give some comments on camera, we'd really appreciate that. And there's one more. No, I think that's it. So I'd like to invite, is it Lucas who's giving the introduction? Great. So Lucas is going to tell us everything that the comms team have planned for us today. Thanks, Lucas.
Thank you, Joy. Good morning, everybody. My name is Lucas. I work for the WHO WMO Joint Office. Communications is one of the primary pillars of GIN and is a huge part of the work where we're trying to build capacity in the network. So because of that, we've dedicated an entire day to communications and really thinking about communications as an intervention to reduce risk from heat in the health context. So this morning you'll be seeing some presentations from some experts in their fields, from NGOs, from public health, from risk communications and from the media. There will then, the morning sessions will primarily take place in the main plenary hall. Then we'll break for lunch, and in the afternoon we'll have 2 sessions running in parallel. So we'll have a masterclass taking place in one of the breakout rooms downstairs. This is designed to be an opportunity to share best practices with experts in the field and to give you an opportunity to really learn from people that are doing it really well. So we have the German Met Service here, we have the Saudi Hajj team as well, who'll be on site to answer questions and to really dive into the technical expertise which exists in the field. And then at the same time we'll be running a risk communications simulation exercise. So this is based on a heat emergency disaster, and we've been working with the World Health Organization to create a simulation exercise which is designed to simulate a really catastrophic heat event. So you'll be put through your paces in dealing with that and in really responding to an event which is going to be a lot to handle. So please do come along. I'm going to hand over now to Margaret. Margaret is going to be the moderator for this morning's panel. Margaret is a medical doctor, a journalist, and a risk communications advisor for the World Health Organization. So welcome, Margaret, and thanks so much.
Thanks very much, Lucas, and thanks everybody for coming today. I think I need to get my presentation up. I'm sorry. Could somebody who knows risk communicators should be good at technology, but I'm the exception to the rule. I'll start talking. While the presentation's getting up, I'll introduce the panel. We've got a fantastic range of skills that really cover the most important elements of the communication of this panel here. So really use this resource. Sorry. Okay, I'll get back to the microphone. We have a fantastic range of skills and experiences on this panel. Covers all of the Western Pacific. We've got Hong Kong, giving the Hong Kong context first of all, and then we'll look at, then we've got a couple of Australians, one who covers the world, so we get the global aspect, and we have John Nen from the Bureau of Meteorology, but I'll introduce them one by one, first of all. So first of all, we've got Alex Choi from the Hong Kong, is a broadcast meteorologist from and a Hong Kong Observatory scientific officer, who's a celebrity, major celebrity here in Hong Kong, a TV star. So and he can tell you what it's like being a broadcast meteorologist, getting the message out, getting it right, and dealing with the consequences when it doesn't always go perfectly, yes? Now we also have Mrs. Candy Leung, who works at the other end of the scale, engaging the communities. And if you do not engage communities, if you do not help them make the action that you're asking them to do possible, then all your communication fails. And she will give you a lot of context on that. Then we have Dr. Chow Yu Fat, who represents the group who are the most trusted of communicators, the medical scientific communicators. Alex also is a trusted communicator, sorry. But really we have found, the evidence has found, that this group are the group that people trust, and he's going to talk about how you communicate the science, the health risks to patients, to people, sorry. And people are not always patients. And then we're going to go into the broader, the world scene, what it's like dealing with the media, what the issues are for the media. And this will be Jason Gale, who's a global correspondent, a senior science editor for the global news service Bloomberg. And he has dealt with all kinds of issues. He's won major international awards, and he's also got a master's in health security. So he really has a lot to offer. And last but not least, as they say, we've got John Nen from the Australian Bureau of Meteorology, who brings nearly 40 years of experience. He joined the Australian Bureau of Meteorology in 1980, and he's done everything from taking deployments down to the Antarctic, where it's a bit cold, I think, to dealing with the Olympics. And he's also set up the Bureau's National Heatwave Service and collaborates with international partners. So we really have, we could say, Jin has talent. Here it is. So I'll just go very quickly through my presentation, because I think what we've got here is what you really need to be listening to, not to me. But what I'm basically going to do is a quick run through the elements of communication that you should be looking to do when you're communicating the risk of heat waves. And then this will be skeletal, the flesh will be put on the bones by this panel here. So, having failed at the technology, let's see if I do better now. Okay, I went through this a bit Monday. The important thing to understand with communications is that nobody understands what it is. To some people, it's using a telephone. To some people, it's having a press conference and, a big glitzy media campaign. To other people, and what I find mostly in a lot of the work I do in, say, resource board settings, it's much more important to do house-to-house personal communications. That's the most effective. So it's hugely different. I'll just go through a couple of things. Advocacy is what most of you probably do a lot in your role as communicators. That's trying to persuade the people in power that the position that you adopt is the position they should adopt in order to get the thing you need done. I would say in a lot of your work, you do that all the time. It's extremely important. If you don't have the engagement of leadership in your country's organizations, you won't get anywhere. But it's only a part of communication. Then there's mass communications, and this is often the default position when you've got a problem. Go to an ad agency, go to a PR agency. It's effective for reach, for dissemination. Everybody might see it, but it's not very effective for targeted messaging. It's there, but it doesn't get into the hearts and minds. So it's a tool, but a blunt instrument. The problem is it often satisfies leadership. They go, yeah, we had an ad campaign, we had, all this. They see it on TV and they're happy, but you haven't actually done your job. So just always remember, it's only a small part.
information, education, communication messages, those are the posters and the banners, the hats and t-shirts. Again, useful, but a blunt instrument. And the danger is if your information's outdated or you haven't really worked with your target audience to understand how they think, you may in fact be giving the wrong messages. We're seeing this at the moment with Ebola. Old posters have been put up saying Ebola is a disease of blood coming out of the eyes and ears. It isn't anymore because we're better at dealing with it. Ebola now starts actually as a diarrheal disease that looks like cholera. And the people in the communities are saying, why are you saying it's this? We're seeing this. We don't trust you. So, posters are useful, but you've got to get them right again. The last, interpersonal communication, working with communities and providing the services and the means of actually making the change. This is the most effective. Mrs. Young from the Red Cross will tell us all about this. But it's the hardest to do. It's resource intensive, it involves a lot of people, it involves a lot of energy, it involves going back time and time again, but it is the most effective. Okay. And so, again, I gave a definition on Monday and I won't labour the point, but it's about risk communication is about providing people with clear information and actionable strategies to protect themselves, their families and their communities. So it needs to be a dialogue. It's got to be both ways. You've got to be listening to them before you start deciding what messages you're going to send. You've got to be thinking all the time. It's about behaviour change. There's a risk. People are doing something. You want them to do something else. Make it possible. Think about how that's going to happen. It's also an educative process for authorities. We have to learn. Often your leadership has to learn, and that can be the hardest part. It is now a fundamental part of the international health regulations. In fact, every country in the world is required to be prepared, to have risk communication preparedness and expertise as part of the international health regulations. And this came about as a result of SARS, which everybody in Hong Kong knows very well. But because in SARS there was a complete failure of risk communication, SARS spread to the world via Hong Kong. And that's why it was identified as something you must do. Again, I'm just proving that I've actually done it, that communities are not stupid. Communities do not panic nearly as much as you think, but they do panic if they feel that information's not being provided, because they lose trust and then they start to look for information from sources that are not trustworthy but much more available. And I certainly found when I did talkback radio, particularly in Sierra Leone, I was amazed by the quality of the questions and the hunger for information. Same thing in Korea. The government in MERS was anxious about people panicking about the hospitals that had cases, so they suppressed the names of the hospitals. This led to a complete breakdown in trust. I was sent there as part of a team to investigate the issues, and we found that risk communication again was one of the biggest failures. And when I went to the communicators, they were working very hard, but they were doing a daily press conference. They thought that was risk communication. They have completely changed their strategy. It's extraordinary. And in fact, we work strongly with Korea now in our risk communication work. And one of the things that the Koreans have worked with us on is an evidence search for what really works. So we went around and looked at the evidence from the last 10 years of outbreaks, emergencies, disasters, and tried to understand from the evidence what was working and what wasn't. And what did we find? It needs to focus on 3 areas. I think I've banged on about this quite a bit. Building trust and engaging with your affected population, understanding your populations and engaging with them as early as possible. Integrating your risk communications into your health emergency responses. And this is why GIN, again, is a great network, because they've put it there as one of the pillars. It should be there from the beginning, not as a oh my goodness, the population's panicking, go and tell them to behave themselves. It's got to be there early, right from the start. And applying evidence. Actually find out what's really going on in your population. Assess it scientifically. Don't just look for something pretty and nice and flashy. Understand your community, respond to them, and provide them with what they need. So, First of all, the most important thing is how do you build trust? And there were lots of clear answers. If you've got functioning accessible services, over and over again, people are told to say, go to the nearest health centre. If it's overwhelmed or it's shut because somebody's panicking or it's got no supplies, that's not very helpful. So you need to make sure that when you're telling people to do it, it's actually possible to do it. If you say ring the hotline, make sure you've staffed the hotline, that it really is a 24-hour hotline. If people can't get through to the hotline, they get enormously frustrated and use something else. Be transparent. If there's a problem with hotline, say it is overwhelmed. Do something else. Admit when things are not going wrong and find a way. Be easy, timely. Tell people what's going on. Admit what you don't know as well. This is one of the most important things we found. Say what you know, say what you don't know. Don't say, oh, we don't know. You don't have to say we don't know, but say we are working on it. We are doing this and this and this to answer your questions. People will give you a pass on this. They understand. It's evolving. So acknowledge uncertainty, address the affected populations. I've said link to self-efficacy. Think of things that they can do themselves, that it's actually possible for them to do. Help them to help themselves. And use different platforms. So at the moment, social media is all the rage, but understand that people do use all sorts of channels. So the North America, everybody's into the Twitter sphere. In Africa, in much of Asia, in the Middle East, everybody uses WhatsApp. Nobody uses Twitter. Understand what people use. Some people trust more the things that they've heard from their mothers or the woman next door. What we've found actually, if they hear the same thing from 3 different sources, and not exactly the same thing, because then they'll think it's propaganda, but if they're hearing the same information from 3 different sources, they'll go, okay, this is trustworthy. So remember that. Remember to send your messages so people can triangulate and say, okay, this is true. We also found it's got to be part of an emergency response. I think we've covered this. We found tailoring information flows. Information flows are one of the biggest problems. So again, this is why GIN's so important, because it's organising the information flows early, it's setting up the partnerships. So ideally, it's all there for people to use. And apply evidence. So one of the problems with communications, they always think it's something sort of fun, go on TV, it's all a bit cute. If you're not applying evidence, if you're not doing it as a technical function, you're not going to do it well. So understand it has to be understood well, it has to be done seriously, otherwise you will fail. I mentioned again engaging with communities because it's the most important thing and it's the thing that's done least well. You need to identify early people the community trusts. Now, most people go to the leaders or the religious leaders, and yes, they may be the trusted people, but not always. Sometimes they're actually not trusted because of the political context. Some people may actually not listen to the religious leaders. So you don't, again, just go, oh, we go to this, 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 and this because it's easy. Find out early, long before your disaster, who are the people who are really influencing the groups that you need to work with, that you need to change or you need to help when the disaster strikes. And involve those people in your decision making about how you're going to disseminate the information, how you're going to craft the messages, what you need to say, how you're going to reach people. Those people you need to identify way before the disaster, and you need to be working with them way before the disaster. So this is just an example, again, with the community taking over in Sierra Leone with Ebola. The place was overwhelmed, all the health centres had closed. This is actually the balcony of a health centre that was closed, but the staff came back because people just arrived from the bush, dying from Ebola. This is a father trying to look after his twin girls on the veranda. The community came up with their own solutions, with our assistance, and built their own Ebola treatment centre next door. And when I came back a year later to find out how everybody had fared, I asked, they had controlled and it wasn't the only way the outbreak was controlled, but I said, you managed, what happened? They said, because you people came and you helped us to do this. And now I thought that was lovely and it put me in tears, but it wasn't that we came, it was that they took action. All that the best thing we can all do is support communities to take the right action for themselves. Messaging. And this is something we all get wrong. Risk shouldn't be explained in technical terms. By what I mean is, don't go into the numbers. Don't go into the percentages. Oh, it's 62.3. We found over and over again that people, it's not just that they get confused. They might have the intellect. It doesn't get into their heads. So say it's a high risk. Just say high risk. Yes, it's going to happen. Yes, no. Even though as a scientist, you fear because you go like, well, there's a confidence interval, there's, the p-values. No, don't do any of this. They need to simply know that you're going on you're on the red team in this. It's a choice of the blue team or the red team. You're going with the red team. This is what it is. As I said before, you can acknowledge uncertainty. This is what it is now. We're doing further research to ensure that we know more about it. That's fine, because that gives you the let out. But don't start explaining it all with numbers, because also people will start debates with you and say, yeah, well, we thought it was actually 61, and you said 63, and all this kind of stuff. That is really unhelpful. Consistent messages, as I said, should come from different sources. So if you've got sort of consistent message, a consistent song being sung, you're all on the same song sheet, it's a slightly different note, but it's the same song, then people trust it, people believe you, and people will really put up with a lot if they trust you. Pre-test your messages if at all possible. As I was saying before, know who the influencers are, know your communities, get people from those communities to work with you. I've often been amazed by how wrong I am, and even though, especially when you've been my medical background, doctors hate to be wrong, but it's really wonderful to find out you're wrong and why you're wrong, and you need to review and reshape. And this is something hardly anybody does. When we looked at the research about feedback loops, about looking at the impact of your message, and and once you got that information, did it come back? Did it change what you did? We found there was very little evidence that anybody was really doing it. It's one of the hardest things, but try to understand how your information, your messages are being received, and how you can then you can alter your messages or reshape them to make them more effective. And at last few tips, and then we'll get on to the people who really know. Be first, be fast, be frequent. Get out there first. Repeat, be very available. Admit what you know currently and what you do not know. I've already mentioned that. Make sure it's practical and actionable. And I did not mention this, but we've got a few of them here. Choose a trusted spokesperson. This is absolutely essential. Ideally not a politician. If it seems to be a kind of glamorous event, your politicians will always want to be out there. But, and I'm very happy to help you with the evidence if you need to explain to them why it should be you, not them. But ideally, and again, if you've got your spokesperson early, you've established them as your spokesperson, it's easier then to roll them out rather than give politicians and the other problem with politicians is they get out there and then it all goes wrong, and they're going, well, where's the spokesperson? Come on, fix this up. So you're stuck in the middle of a real disaster. Build, as I said before, identify and build links with communities likely to be affected before, and practice, preparation. Do simulation exercises, desktop exercises. Really know what you're going to do long before you have to do it. And with having said all that, I'm going to call on our first speaker, Mr. Alex Choi, as I said, a broadcast meteorologist and a Hong Kong Observatory scientific officer, to give us what it's like really at the front. Please come in.
Good morning, everyone. First of all, I'd like to apologize for my voice. Quite ironically, I caught a common cold before going to this Heat and Health forum. the observatory, for those friends who are not from Hong Kong, the observatory is indeed not really an observatory. We are not a group of astronomers, most of us. We are actually the government agency for weather forecasting, basically just like a NOAA in the US or BOM in the Australia. So I'm going to talk about how we, as the observatory, try to um, communicate weather hazards, different kind of weather hazards, not just for heat, but also other types of hazards, especially for heavy rain and tropical cyclones in Hong Kong. Um, well, besides giving out weather forecasts, the observatory is also strive to pay a lot of effort to try to educate the public, to let them understand more about the potential risks of different weather hazards. This is so that they can prepare for when it comes. So if we talk about the heat or hot weather in Hong Kong, uh, what the public really need to know. What we think is that a lot of us have access in Hong Kong. They have access to weather forecasts. They know what the temperatures, what the numbers are like. In Hong Kong, most of them are used to temperatures like in the 30s, 31, 32, they're okay. When they see high temperatures like 34, 35, they know it's really, really hot. And lots of them already know the precautions, what they need to do, most of them. But the high temperatures, especially for friends who are not from Hong Kong, you may realize that when coming to Hong Kong or other places in the tropics, that the humidity is actually indeed another crucial factor that affects how you feel, how comfortable you feel, and of course how bad they were going to affect your health. So there are other measures that have been developed, like WBGT, that is web globe temperature, that are quite relatively more common across the world. But we have, in Hong Kong, we also developed a Hong Kong Heat Index, more or less the same, but um, we try to correlate the humidity and other factors, and I try to correlate that with the hospitalization rate in collaboration with CUHK, Emily Chen from CUHK, and after. But this is actually quite complicated when we actually get this heat index to the public. They see a number, but it's not a number that they are used to. Temperatures, they know 35 Celsius is very high, but when they see an index of, say, 30 or 31, what does it mean? Is it a temperature? Is it something else? And we find that it's actually quite not an easy task, even for a modern city like Hong Kong. We try to let the citizens in Hong Kong to know. So here are some of the efforts that we are trying to communicate or giving out public education on this. Now, before going into that, we all know that the world of communication is changing. In the decades ago, we are more like rely on the media, the traditional media like magazines, newspaper, radio, or television to give our messages. In relatively recently, like 2 decades since we can set up our own website, we also later develop our own mobile web. This is also how we can get our message across. But this is more or less more a one-way approach. And quite recently, or like in the last 10 years or so, we see the world of social media and how it's impact. So we have lots of different platforms like YouTube, Twitter, Facebook, Instagram. They provide us a new way to try to communicate with the public, not just a one-direction way, but it's also a two-way that we can see instant feedbacks. What they understand, what they don't understand, and I'm going to talk about more. Is more than that. Is actually it's more than just one and two way. And well, it's quite recently that the Hong Kong Observatory has set up our own Facebook page. We set up other platforms earlier, but we only set up our Facebook page earlier this year. And right now we have about 120,000 followers. And here is what we try to do on Facebook, on also other social media platforms to try to communicate the different hit rates and the Hong Kong hit index, as I mentioned. And here's a short video, and I'm going to show the fuller version. I'm going to skip a bit, but it's in Cantonese. I'll try to comment it as
有
much
時
as
候
possible. But,
太多嘅説話擠壓咗聆聽嘅空間。
what I'm trying to say is that we need a lot
經過一個寒冬，
different strategy
串
when
嘴
we go
菜
into
生
social media.
始終解答唔
Here
到
in the
姜小
first
姐，
part, you can see
到
we
底點解
engaged
天文台
a
控制唔到
local
天氣？
voice talent, quite a famous one, to
又
try to
嚟
do
到
the
炎炎夏日，
introduction.
佢
And
哋可唔
here
可
is
以
a
康高地相
previously
處？
on because there is an earlier
我係鄭子誠，
edition.
又或者你可以叫
And
我做
then
音樂情人。
this is not into the content yet. We
夏日熱
spend
辣
a
辣，
lot of time
香
to
港
try to
樂壇
prepare the
欠
audience,
福
to try
頭
to
老師
attract
一
the
個交代。
audience.
搞
How to
咩㗎？嗰時咁晚仲未嚟㗎？你點做嘢㗎？
what we're going to try to say.
我姓
We
姜
need to
啊，
catch the
姜睇
attention
我
first.
姜啊！
So it's, you can see
喂喂，
after
你
like a
冷靜
minute
啲
or
先，我
so,
翻緊嚟㗎
we
啦。
try to use a
呢把
short
聲
story or mini movie
原來就
before
係
we
佢。
can go into the details.
唉，個天文台都唔知點做嘢，天氣咁熱都唔識搞得幾度
喂，。講樣好笑嘅你睇啦，原來有
And
人以為天文台真係可以控制天氣㗎。
控制唔到天氣，學人做
Talk
天文
about
台
the
喎，
girl
一
is
個警
complaining
告
about
都
the
冇，
weather
唔理我哋
forecast
啲
issued
小
by
市民
the
生死
observatory
㗎
and
啦。
that
其實天文台就有個酷熱天氣警告
she
嘅，
finds it's
當
not
預計
so
有酷熱天氣
useful
出
and why
現，
it's so
就會發
hot.
出警告提
She
醒市民
feels
㗎
so
啦
hot, but。
喂，你識唔
it's
識
still
㗎
not？
今日成30
the
度
hot
都
weather
唔出酷
warning
熱
is
天氣
not
警告，
issued.
真
And
係死
then
人
I'm
咩？
trying
酷
to
熱程度啊
the bad
33
guy and
度，
then
咦，叫
trying
中
to
下咗
honest
得罪講句，香港濕熱世界第一咯，未有33都熱死啦！你突然又出啦，又話33，方法生活。
how the
啱
humidity
啦，
is going to
濕
affect
度高
her
啲汗水蒸
perception.
發唔到，就會覺得更加
And then
熱。
I'll
三十
skip here a bit.
仲將啲數據
Here we
分
use
咗
some
儀器量
insights
度
and
濕
then
度、
we talk
風
about
速
the
同埋太
this is
陽
a
照射對溫
like
度
the
嘅影響。
WBGT
仲將啲
setup
數據同香
and
港居民
how
入
we
院情況比較，
here
就
is the
香港
science
暑熱
part.
指數。
How
當暑
we
熱指數接
correlate
近30，就
the
代表暑熱
heat
天氣
index
有機會
and
對健康構成影響。提升仲未做好防暑措施。
that's
酷
why we
熱
said
暑啊 whatever 啦，
criteria
有巴士再入嚟真係酷熱中暑熱死啦！你班
Now you
人
can
真
see
係
that
仲得㗎喎。
whole of this 3 minutes or so
架巴士肯嚟未啊？我等咗好耐啦。
content represents is only maybe half a minute long. And at the very end, we also try to stick in some precautions.
Hello，大家好，好耐冇見啦，我係姜小姐。一下子陽光會出去搽防曬，保護翻我哋啲靚
Here
靚。呢啲真係超好用，爆好好勁好用。雖然我收咗之後都未用過。一出去點一定時定候要補充水分，呢啲就係
what we call KOL in Hong Kong, and that she's trying to
水，今日
sell
更
some
加環保啦。
products.
最緊要嘅係菜衫，香港都幾好嘅。今日就到呢度為止啦。大家中意嘅可以俾個 like 同埋 follow 天文台嘅 Facebook、Instagram 同埋 YouTube 㗎。拜拜啦。
Okay, so we all know that for communication, especially for educations, content is always the king. We have to have our message that we want to get across. We all have that. We may also know that packaging, making it attractive is important. What I'm trying to say is that on social media, being it attractive is actually more than getting compliments from the audience. They're just it's more than that. Of course, it's good that they say, oh, it's quite funny, but it is actually affecting how much or how many people you can further reach. This is just how social media is working. Now, for those of you who are, I'm sure a lot of you are familiar users of Facebook, you know that very, very few people will actually go into the Facebook page and look at the content. It's just if that's the case, then it's just a website. We can put everything on the website, but social media doesn't work that way. For social media, we can see that most of the people, we see 99% or more than that of our contents from a newsfeed. So the Facebook platform or other social media platforms controls what goes into your newsfeed. What they control was you are going to see. Of course, this is how they make money. If you pay ad, and it's more likely that you're going to see it. But if we are not that extravagant, we are not that trying to pay a lot of money, what we can do. So all these social media platforms, they have a algorithm that when you have something that is very attractive, and then they will look into all the users that who has seen the content. So when we issue a Facebook post, Hong Kong now, for Hong Kong Observatory, we now have say 100 or 1,200, 120,000 followers. When we issue it in the first 15 minutes or half an hour, if we are lucky, we can get our message to perhaps 3% of our audience only. So how can we make sure that more people can see it is that if those a few percent of the audience, they like the content. What I mean they like the content is that they engage in the content. They watch the video for longer. They hit the like button, like, comments, shares. All these engagements are going to make Facebook think that, okay, this is a good content, and I'm going to push it to some more people. And so this cycle is actually not only just trying to get praise from the public, but also is how to make sure that our message, the message that we want, is can get across. So here, for the video that I've just shown you, you can see that that's why we only have maybe put our content, try to squeeze into as short as possible, first 30 seconds of the most important content that we want to get across. But we spend a lot of time to try to engage the public, engage the audience that, okay, I want to see this, I want to know what's going to happen next before we put into the content that we are trying to talk about. Now, of course, we're still learning during the good days for public education on our social media platforms. We try to make use of infotainments, information and entertainments. Combination of this, like the video before, that we try to use this to get our message across. So here's just a few examples.
日本東京一直係香港人嘅旅遊熱點頭幾位，但係唔知大家有冇留意到，我哋搭飛機時去程會比回程快嘅喎，到底點解呢？
嗰個地球轉呢邊，跟住個飛機去嗰邊。
但係咁其實係錯㗎。其實咧係地球自轉所造成嘅科氏力。咁飛機向西飛嘅話，其實係逆風而行，順流應該都好少人識㗎。
I think one of the successes, besides the packaging of this video, is asking the right question. So when we we set the topic to talk about to make this video to talk about why is it faster to fly east. The example in the video is flying from Hong Kong to Tokyo, because Tokyo is one of the most popular destinations for vacation for Hong Kong people. Why is it faster to fly from Hong Kong to Tokyo than the other way around? And so for those of you who know the answer is because when the Earth rotates, it actually makes the airflow in the upper atmosphere, that's where the airplane is flying. It makes that the air there mostly be flowing from the west to the east. So for tailwind, when the airplane is flying with the wind flying east, of course it will fly faster, and the headwind, they will fly slower. This is quite a simple answer, but a lot of people don't know that, and we try to package it into a short video of 3 minutes or so. And a lot of people want to know the answer, and they find the graphics and everything packaging is attractive, and that's why a lot more people know the answer now. And we also try to partner some of our videos with a celebrity. And in this video, here is a local TV star, and you can also see that.
出邊水浸㗎，你仲係掛黃雨？我游咗咁多年會
The other one is actually the director of the.
你嘅暴雨已經令到呢邊水浸。
而家你嗰邊大雨啫，我呢邊冇喎。明明叫呢個鐵雞飯加息，但係咧淨係得局部地區有豉油。咁你話啦，局部地區落大雨好奇咩？嗱，要預測落大雨咧。其實好似估呢煲水啲氣泡幾時喺邊度升起咁樣，所以其實落大雨係好難預測嘅喎。
切雞飯加息，全面唔要局部。
And here are a lot of different other infotainment posts that we're trying to. So we make use of a lot of different social references. That's how the netizens are going to want to know, and they will find it familiar and want to share it with their friends. Now here is a lot, some more of these posts. We go to Facebook and you can see it. And this not only to try to educate the public, but it also lay the groundwork for our platform so that our message can get best across during the bad days. Bad days, I mean, when there are high impact weather. So in Hong Kong, heavy rain and typhoons are the most two common hazards, weather hazards. And here is actually a water spout spotted by the public. It's not really really a bad one, but because of our social media platforms, one of the advantages is that our followers actually see this and then they send it to us himself and then allow us to post it on our platform. And before the when severe typhoon is going to hit us, and we also because we have quite a number of followers on our platform, and then we can engage the密切留意下呢個天氣嘅情況啦，避免參與呢個水上活動啦。即係萬一出咗事嘅時候咧，就唔係你一個人嘅事啦，就可能係影響你嘅全家人。Some people like storm chasing in Hong Kong, and this is to warn them against it. So just going to end this, we for Hong Kong Observatory. We are not only a government agency trying to give a weather forecast. We believe that nothing in science has any value to society if it is not communicated. We spend a lot of time to try to educate the public of the message we want to get across. And thank you.
Thank you very much, Alex. I'm sorry to cut you short. There was so much more we'd like to hear, but everybody will get a chance to ask more, and I hope we can see more of your videos. They're really good. As Alex mentioned, much of what he does is warn. Mrs. Candy Young deals with the community and helps them react in a way to keep them safe. And she's now going to come up and tell us of the work of the Red Cross with communities.
Good morning. First of all, thanks, Alex. As Margaret said earlier, clear and timely message is very important in risk communication. And Hong Kong Observatory is a very good partner of Hong Kong Red Cross. Just in the recent Super Typhoon Mangkhut, once we receive the early warning signal from the Hong Kong Observatory, we can activate our pre-disaster service for the vulnerable groups, like in the Taipo village, which is a flooding-prone area. We can mobilize our staff and volunteers to help those single elderly to lift up their furniture and remind them the do's and don'ts in prepare for the coming super typhoon. So we'll continue this good collaborative work. Before I talk about the Hong Kong context, I would like to briefly introduce the Red Cross and Red Crescent movement. We are the world's largest humanitarian organizations, make up with a huge number of volunteers and supporters in 191 national society, that means countries. And we have the three main components. The first one is the International Committee of Red Cross, which is mainly deal with the armed conflict and the promotion of international humanitarian law. The second part is the International Federations, which it had 13 reference center, specifically to do a lot of research and promotion in different aspects. And for the reference center of climate change, yesterday Julie have also shared their work. And then we have the National Society. And since you can see we have over 119 national society, we need to group them together. So I just to share with you, Hong Kong is belong to the Asia Pacific region. And it's interesting that for the Asia Pacific region, not only included traditional countries, but it involved the Middle East country as well. So it's talking about 15 national society to join this regional conference held in Manila this November. I joined the conference. It's very amazing because after the week-long conference, we have set out the Manila Declaration, which will steer us the direction in the coming 4 years for this national society to develop their service. And I'm pleased to report that climate change is on the agenda. We have a specific target to strengthen our capability in the context of climate change, because as you may be aware, Asia Pacific region is almost 2/3 of the world natural disaster. And this catastrophic disaster due to the extreme weather events will bring devastating impacts on the life and livelihood, leading millions of people leaving their homes as migrants or refugees. So therefore, it is very important to collaborate with the government and different sectors to prevent and prepare and respond to these hazards brought by the climate change. Now let's go back to Hong Kong now. The Hong Kong Red Cross established in 1950, and before the handover, we are the branch of the British Red Cross, and after the handover, we are the branch of Red Cross Society of China. But we have a very high autonomous status, so we can do a lot of things on our own, and there is no need to report or submit any funding to the Chinese Red Cross. And as the same as other national society, we will perform the auxiliary role to the government as stated in the international statute of the whole Red Cross movement. So in Hong Kong Red Cross, we have been providing more than 20 types of service locally in the mainland and overseas. And you can see in the picture, there are different types of services we provide. And there are some unique service which is only provided by Hong Kong Red Cross, like the tracing service and the blood service, and also the hospital school service as well. And it is very important because of this so many type of service. It enables us to have a comprehensive community network which will help us to disseminate the disaster preparedness messages. Starting from last year, the Hong Kong Red Cross have our own strategic plan. And you can see here our ultimate goal is to lead and mobilize actions and voices for humanity. And we'll do it through these 3 strategic aims. The first one of the emergency response covering the local and overseas. The second one, community resilience, and which I would like to explain more, is we need to build up the capacity for our community in facing for all the disasters. And the third one is the promotion of humanitarian values. So how can we engage community to reduce their risks? For me, I think 3 aspects is very important, and I'm going to share my views with you all soon. The first one is increase awareness. The second one is to build their capacity. And the last one is how to put those knowledge into practice. For increase in awareness, we just launched disaster preparedness mobile apps. This is some of the screen you can see it from the apps. It shows the common about 10 natural disasters that happen in Hong Kong, and we will provide a lot of the messages. What needs to be done before the disaster, during the after, and after the disaster. And then we provide a lot of interesting knowledge or through games and or some connection with the police or useful link, so that people, when they just download the app, it is free of charge and they get what they want. And like for the heat wave, we have a specific page on that, and we have also produced some leaflet in Chinese and English. Some of them already a table at the reception table. If you're interested in, you can get a copy to have a look at it. So all these will help them better equipped, especially during the peaceful time. They know what should be done. The second point is, okay, once their awareness have been increased and they want to equip themselves, how they could be do so. So we have just developed a new comprehensive program in different levels, and this is also free of charge. For the foundation course, 3 hours. It will give the participant a general knowledge about, of course, about what Red Cross is doing, what are the major threats and disasters that they need to do the prevention, some first aid or psychological first aid knowledge. So they will have a general idea, as Margaret just mentioned. If you have the right information, you will not panic, and you know how to get the right information or actions to be done. So once they take this 3-hour course, if they're interested in, no matter it's a crisis module, communicable disease module, or first aid module, they can choose this as a 1-hour course, and we will invite as experts to share their knowledge or experience. And after that, of course, they're welcome to join our first aid course or psychological first aid training course as a qualified people. Okay, now we have so many knowledge, how we can put them into practice. So I would use our heat wave project as an example. As Hong Kong Observatory Director Shen mentioned on Monday, the Hong Kong weather is getting hotter and hotter. And in addition to our humidity, people simply not feel this is a problem, but this is really the problem because they don't feel it. So the one thing that we do is to conduct some humanitarian caring summer visit. And I just showed the videos so that you can hear directly from our surface target.
今年7月20几号是大暑嘛，哇，我因为心脏病啊，我心脏病三条这个管都塞住了，心脏病是最怕的。边汉波拉达这边住，要了，反正出来很凉快嘛，你到里面累死掉。
Okay, so as you can see from this video, this is a very poor is shaping estate in the Guntong area, which have a large amount of elderly people, especially single elderly. So how we can approach them? We work with the local NGOs because in Hong Kong we have very good supporting environment. So we work with those NGOs and then to select those household, those people they willing to let us help them. So we go to their house and then to explain what they should do during this time. And as you can see from this lady, she is also suffering from some chronic disease as well. So after the visit, we'll do the follow-up, like to give them some electric fans, and also maybe to refer to especially those what we say hidden single elderly. So we identify them and then we'll link them up to the local NGO so that they will have more medical or other social support for them. Okay. So of course, during the visit, we will hand out our leaflet and our volunteer will talk to them and see what they need. Sometimes, like those home safety issues, we will pick it up and then we will give it to the relevant government department or organizations to help them. And the other part, another area that we have done is the subdivided flat. For those of you who would like to get a feel what is the feeling in living in a subdivided flat, tomorrow we have a visit in the Energy Property Lab, so you can have a feel with that. So again, this one, we partnered with the local NGO and identified the group that need our help. This is an area, is the Yaojin Wang district, which is a very old district, and have those subdivided flats are mainly situated in those old tenement building with a lot of safety problem and lack of proper ventilation. So when we visit them, it's very touching story actually. those people, it's very hard to earn a living. So we can only come to their home at a very light hours. And those people, some of them are ethnic minorities. So they share with our volunteers that they know it's dangerous. But because of the high rent in Hong Kong, it is the only way that they can have. So when we visit them, they not only feel the knowledge, but the love and care by the local people as well. So they know how to escape during a fire or maybe during the heat wave, what they can do. And some of the families are really poor. So after the visit, we try to liaise with different party and then we'll give them some electric fans as a gift and help them to improve their living. So this is a heat wave is a sort of a point that we can enter the local community and help them. Okay, this is the app that I just mentioned. If you would like to download, please, you can just scan it. It is in Chinese and English. And I just would like to highlight that when we launched this app in October, during the International Disaster Reduction Day, we're happy to invite the Undersecretary for Security to officiate this launching. And I think it is very important to have not only the corporations or NGO, the government support is also very important. As Margaret mentioned, the advocacy on that and work together, the collaborative effort is very essential when we are talking about risk management and promotion. So Hong Kong Red Cross alone is not enough to engage the community to reduce risk. We need the collaboration from all the party concerned, and let us join hands to work together to make this a better world to live. Thank you very much.
Thank you very much, Candy. And that's a magnificent illustration of getting right into the community. And I have seen Red Cross volunteers in the most difficult place. I lie. They've been in the difficult places that I haven't been able to reach and doing the jobs that nobody else does, like safe burials and all sorts of things. I really, hats off to the Red Cross. And this is true community engagement. You mentioned that partnership and collaboration with experts is essential, and we now have Dr. Chow Yu-Fat, who is very much one of those. He has many, many hats, but I think we're going to be talking really your hat in disaster preparedness and how to talk as a trusted expert to people who need to get your information.
Good morning. Thank you, Margaret. Today, I would like to talk about three things, share with you. The first is about the content that as doctors that we would like to share with our citizens or patients. The second is about the health education to groups of patients and individual information on how do doctors counsel patients individually in relation to the heat wave. And the last thing that I would like to share with you is about our organization in collaboration with the Hong Kong Academy of Medicine, the Hong Kong Jockey Club Disaster Preparedness and Response Institute. So about the content, as you know, we hope that doctors are content experts for providing information on the health impacts related to heat wave. So they will be classified into two major categories. One is mild and moderate, the other is severe. So for the heat illnesses, the mild ones that do not require hospitalization are mainly heat rash. They are just skin reactions to the heat and the moisture of the rash, and usually subsides with no specific treatment. Then there will be heat edema. These also are not required treatment, are related to peripheral vasodilatation of the capillaries to the skin. So there will be fluid accumulated into the peripheral areas, resulting in edema of the lower legs or sometimes of the arms. And it usually subsides after colleagues or persons used to the heat weather we call the phenomenon of acclimatization. Then getting to more serious would be phenomenon of hip cramps and hip syncope. For hip cramps that infects on the muscles that this musculoskeletal system reactions to the heat phenomenon. So when we are doing exercise during the heat weather, we will experience hip cramps because accumulation of the excessive waste products generated from the muscles during exercise, they are not able to be cleared fast enough, accumulated into muscle fibers, resulting into cramps. And this will subside with adequate oral rehydration, and when the person rests in cool area, the muscles get enough rest, then it will spontaneously subside. But sometimes if there is prolonged cramps, if it is very long, then you call another phenomenon which results in breakdown of the muscle fibers. That can be serious and they need medical attention. Then the other more serious one is the heat syncope. That means the patient or the citizen lose consciousness due to prolonged exposure of the heat that affects the central nervous system. The mind becomes lost, and so the patient drops flat. And the initial help will be lie the patient flat, maintain the cerebral circulation to the brain so the legs and hips to be elevated to improve the venous return. Then the more serious information that we will need to alert the citizens related to heat is the heat exhaustion and the heat stroke. These are the areas that need medical attention and sometimes resuscitation. One of the key messages that we would like to spread across to the Hong Kong citizens is that heat exhaustion, heat stroke kills. And it kills suddenly and rapidly. And sometimes patients may not be admitted fast enough to the hospital, and they really dead in the street. So they need to be aware of the subtle symptoms, and not the patients, but also the neighbors, the buddies, who are aware of the issues or the symptoms experienced by the persons in trouble. They need to escort or transport him immediately to the hospital. So there are heat exhaustion and heat stroke. The heat exhaustion mainly is nausea, shortness of breath, and also mental confusion. Imagine if the patient or if the citizen is mental confusion or confused, he or she cannot help himself. He or she needs help from others. So neighbors or other citizens need to be aware of those colleagues or fellows who are in trouble and need medical attention. For the heat stroke, the patient will suffer convulsion, unconsciousness. The rhabdomyolysis, which means the muscle breakdowns, we call multi-organ failure. This need immediate attention to the medical intensive care hospitalization. And being anesthetist, and sometimes we are called upon to resuscitate this group of patients inside the hospital. The patient will suffer severely mortality, or even if he recovers, will suffer morbidity related to different body systems after the heat stroke. So who is at risk? That depends on that will guide us about the communications on the levels of the public health education. I copied this information from our locally the Center of Health Protection on their website about the prevention of the heat stroke. They mentioned who is at risk: the obese who cannot dissipate the heat effectively, the sick people who suffer comorbidities, who cannot compensate or cannot deal with the heat stress because of the sickness, the elderly because of the loss of the sensation of the thirst, sensation of the heat, so that he or she only suffer the heat stroke at a late stage. The psychiatric patients, those who are schizophrenic, catatonic, schizophrenic, depressed, they cannot have the behavioral modification to avoid the heat stress. the children, that depends on the carers to look after under the heat. And as Candy mentioned, the socially deprived or socially isolated, they have less resources or adaptation to deal with the heat stress. These are some of the apartments that can be still seen in Hong Kong in certain districts. You can imagine the heat stress they are facing in different households of these apartments. So for doctors, we provide information, advice to the public. These are the general advices disseminated by the Department of Health, the Center of Health Protection, when we are dealing with the heat stress, like keep your home cool, keep out of the heat, keep the body cool and hydrated, help others, be buddy of your fellow citizens, because those who are in trouble due to the heat will not be aware of themselves. They do not know they are in trouble. So beware of those who are in trouble and help others. So if you have a health problem, that means if you are sick, you are more prone to heat damages. And if you or others feel unwell, go to seek medical attention. These are the general information, general content provided by doctors or experts to disseminate to the Hong Kong citizens. Then for family physicians or individual consultations or counseling, the advice, the communication that give to individual patients need to be tailor-made. So for family physicians, we need to understand the physiology of the thermoregulation of our human body, how to deal with the heat stress, understand the reactions, the combination of the heat with various diseases, especially those with hypertension, ischemic heart disease, other diseases that affect the renal function, and also advise the individual behavioral adjustment in dealing with the heat, and also initiate proper cooling and resuscitation when we are facing with patients under acute stress. As said before, identify the vulnerable groups as advocated by the Center of Health Protection, encourage proper education with accurate information and counseling incorporate them into counseling for the individual routine care of chronic disease. Chronic disease management is a huge area facing Hong Kong nowadays because of our aging population. And so also beware of the side effects that induced by the heat on our medications, on the effects of the medication when we are treating the chronic diseases. For example, the antipsychotic drugs may retard the normal compensation of the body for thermoregulation. The vasodilators, some of the drugs that will lower the blood pressure, will enhance the peripheral vasodilatation and will further decrease the blood pressure when the patient suffers from heat stress. And some of our anticholinergics, another group of drugs that reduce sweating, that block all the sympathetic effects for the compensation of the heat, will also make this group of patients more vulnerable to the heat. And we also need to monitor the drug therapy and then also the fluid intake according to the individual patient hydration status. For example, those who are in heart failure may need different requirements of the fluid intake when we are dealing with the heat compared with a normal citizen. So drinking recommendations need to be individualized and personalized. And also, it's not only about the water issues, it's also about the electrolytes, like the common major electrolytes, the sodium level, the potassium level, that we need to keep the patient in a safe level. A personalized drinking recommendations according to health status is pivotal to patients dealing with the heat conditions. So some of the adverse drug effects during hot weather that I have already elicited. Some of the impact about the heat is about causing dehydration, the blood concentration. On this area, they will in fact affect the mechanisms of the drugs dealing with the patients having on the chronic disease. For example, they will affect the distributions of the drugs inside the body, and they will affect the drug level, how the body metabolizes the drugs, and finally will affect the action of the drugs, the drug efficacy, when they are entering the body of the patient. Sometimes it will also affect the shelf life when the patient stores the medications outside the advised temperature, usually is below 25 degrees Celsius. If these drugs are stored in a prolonged exposure of an environment higher than 25 degrees Celsius, the decay or the deterioration of the drug effect and shortening of the shelf life of these drugs will be need to be accounted as well. Especially for some drugs that need to be refrigerated, like the insulin preparation, they cannot be allowed to be prolonged exposed into temperature of higher than the recommended ones. So I do not further elaborate for the heat action plan that will be covered widely in this symposium. But for the medical doctors, we will be highlighting on these areas for individual patients or citizens facing with the health problems. So I covered the content, the communication strategies for individual patients to groups of patients and general public while the Center for Health Protection. Then just for the last few slides, I would like to share some of the work of the Hong Kong Jockey Club Disaster Preparedness and Response Institute. This is our web page. We are set up in 2014, funded by the Hong Kong Jockey Club. We are mainly serve as a knowledge hub. We are not service provider. We are building on the knowledge, share our knowledge, so we collaborate locally, regionally, and globally. We work on the 3 levels, the policy levels, the research areas, and provide advice on the practice for different collaborators. So we collaborate with Hong Kong U, CUHK, the University of Science and Technology, Manchester University, Harvard University to generate and share our knowledge. We also collaborate with our mainland China for various disaster preparedness projects and also the WHO. These are the work that we have been published in our website. We have a scoping studies of the Hong Kong's emergency and disaster response system related locally. And we also have a policy published on the climate change in Hong Kong related to these areas. Then we, on the research with the University of Science Technology, we work on the landslide model, and in the Kanduri areas, they build a plume areas to study the model of the landslide. And we also work with the university and government agency to develop the smart landslide information system to alert the Hong Kong citizens of the areas that are prone to landslides. And for the locally, for the community engagement, we work on the TIO project for the flooding risk for this district. So that's all I would like to share. Thank you very much.
Thank you very much, Dr. Chow. I've got a lot of questions for all of you, but I will let the audience have questions first. Now we're moving from what you do with the community to the global view, and also to a really important partnership with the media. Now, the media are there to provide news, and they are the most accessed form of information, but they have their own agenda, and we've got Jason Gale here to tell us all about it. Thanks very much, Jason.
Morning. Thanks for the introduction. I'm Jason Gale. I'm a senior editor with Bloomberg News based in Melbourne. I'm more comfortable communicating via the written word than the verbal word, so if I start to read from my script, apologies. So this session is really designed to help you figure out how to leverage people like me and my colleagues into communicating your risk mitigation messages. Okay, here's what I'm going to go over in the next 10 minutes. Perhaps if there's time at the end, we can I can answer some questions, or we can leave it until the panel discussion. So for the last 19 years, I've been working at this company, Bloomberg News. It's the world's largest provider of financial news and data. Top left is Mike Bloomberg. He's the company's founder and former New York mayor. And if you haven't heard of him, you will be soon. I'm going to be very cryptic about that. My views are, of course, my own and do not reflect those of my employer. Besides the Bloomberg professional terminals that people working in finance use mostly, news is carried by Bloomberg Television, Bloomberg Radio, Business Week, Markets Magazine, and of course the website. Our stories are also syndicated to hundreds of newspapers around the world. They're on Facebook, Twitter, WhatsApp, Instagram. We're all over it. We focus mainly on business news, as I mentioned. Our sweet spot in health coverage is its intersection with companies, the economy, and with governments and policy. We stopped covering public health and medical science independent of those elements several years ago to focus more on what our core fee-paying readers really care most about. We can gauge in real time what readership our stories are getting, so we can get a very clear signal of what people really care about and are reading. So these next two slides are really out of date. I apologise. They are, all the numbers are much bigger, basically. Last month I had the pleasure of working out of our bureau in Accra in Ghana, and our bureaus have popped up across the developing world since I started in early 2000. A quick look at who's reading our news and where. Again, I'm using slides originally prepared many years ago, so this gives you just a general overview. Basically, there are a lot of rich people who manage lots of money. Now, these days I mostly edit feature stories, so this is an outline based on 30 years experience working in the media. The main message here, and I think that I'm aware that these sort of forums become a bit of echo chambers, but and we've already heard from Margaret and from others that a lot of this stuff, but essentially with news, you don't go to read news to get a hit of dull public service announcements. You want to be informed, you want to be entertained, you want to be enlightened. This is an old slide I've used to show over the years which health columns from Asia got the most readership. It gives you a flavour of what stories resonated the most. That's among our fee-paying readers. I'm not sure how well you can read that. But men over 40 should think twice before racing triathlons. Brazilian bikini waxes. Now that made it onto the Daily Show in the US. I have to take credit for that one. Not sure that the science was really there to back it up, but it was definitely entertaining. So I want to tell you a bit about how we operate as journalists. Unless it's a news topic that's really germane to our readers, we're not interested in repeating what's already out in the public domain. So we try to find fresh angles, fresh ways into reporting news or packaging it. We really want to ask, how can we add value here? And to be honest, I'm really impressed with what the Observatory is doing and what the Red Cross is doing. You're stealing our readers, I suspect, which is a good thing, because you're giving information directly to the public, and I think that's excellent. So if there's a heat wave, for example, we're going to expect high mortality in vulnerable groups such as the elderly. That wouldn't be surprising. So a question we might ask is, are there other groups whose vulnerability may be less well understood or known? About who may provide a fresh angle in anticipation of or in the wake of a heat event. That could present a surprise, and we love giving readers a surprise, which would again gain stronger reader interest. So we also look for and want supporting data. We love superlatives like the hottest day in 20 years, or the longest heat wave since 1967, or the most calls to emergency services ever recorded in a day. That kind of thing. Of course, this is really only relevant at the time of an event, which can usually be anticipated a day or two ahead of time, thanks to the folks at the Observatory. So telling the media, for example, that in Hong Kong, that Hong Kong experiences hottest daytime temperature in at least 50 years, causing 20 people to die, is not going to be useful if the media gets that a week after the event. As a younger reporter, I was told that names make news. Details of hospital names, locations, spokespeople, these all resonate more strongly with readers than generic places and unidentified sources. So we strive to include this in our reporting. We also like to use anecdotes or small stories from real people who can help personalise the news and provide what we call colour. That's details that add an extra layer of credibility or reliability. Now, some 11 or 12 years ago, the WHO in Geneva invited me to work with them and public health officials from around the world on pandemic response planning and communications. I recall sitting on a panel and an epidemiologist and also, from Australia, you probably know her, Margaret, telling me that in the early days of a pandemic, the WHO would have very little to say because there would be a dearth of scientific information available. And anyway, I won't go on about my response, but the information vacuums get filled. If credible, authoritative organisations won't comment, the media will go elsewhere for answers. You may not want that. My understanding from talking to Ollie from the University of Sydney, is he here, Ollie? Ah, there you are. Okay, we might have to catch up later. Is that evidence-based recommendations for mitigating heat risk is pretty weak. And I think integrity around that is important, so you don't want to misrepresent ostensibly prudent and sensible advice as scientifically validated recommendations. But I suspect there is a lot you can say to the media that could help reduce heat-based mortality and morbidity. And when these are delivered in a timely way, they can be dressed up as news and they will get good readership. I saw that actually with covering Ebola. I did a story that Margaret might tell you perhaps the size behind it was a little weak, but it essentially was telling people that the way to recover from or survive Ebola was to keep drinking. And that was some published stuff that was coming out, but yeah, maybe a little contentious. Yeah, fluid replacement. Anyway, moving on. Ideally, you want to establish relationships with key journalists in advance of a heat event. So you already have some level of trust and understanding. You know who these people are. I think you'll be surprised at what you can learn from us in exchange. So here is some food for thought. It's not an exhaustive list. We know that extreme heat and other weather-related events are becoming more severe and more frequent, and they shouldn't take us completely by surprise. It's a phenomenon we are going to have to be prepared for and sadly live with, at least in the foreseeable future. There are things you can be doing now. This is people like the Observatory, for example, the Red Cross, others working that are going to be engaging with the media. There are things that you can be doing now in preparation for this, like dusting off your fact sheets and collecting statistics that journalists are likely to want to meet their desire for superlatives. Please try to have your most senior people accessible to the media for interviews and press conferences, and think of other people, perhaps in other government agencies or academic institutions, to whom you can refer journalists for additional information. Good news stories are almost never based on a single source. Also have a clear message and provide as much supporting data or evidence as you can. And where there is no scientific research to back up your advice, make that clear, that it's based on anecdotal information or that it's plausible or reasonable based on what we know to be true. I hope that helps. I'm going to be involved in a panel discussion later and will be around to answer any questions, or feel free to get in touch via email or Twitter. Thanks.
Thank you, Jason. And you know, that was a fantastic quick tour of what it's like to be a journalist and what you need. It's really good. And last but not least, we have John Nen from the Australian Bureau of Meteorology. We're kind of landing the plane back in Australia.
I don't have a presentation, so that's easy. So the benefit of being a late inclusion, so sorry about whatever. Please ignore the screen. So I'm late inclusion possibly because of my breadth of experience in dealing with the media. Are you going to get rid of it for me? Thank you. Anecdotally, I'll just add one thing before I go too far. I think your boss is responsible for a very big climate change issue I just want to add that because recently the Australian Institute of Company Directors has been running sessions, panels, where the initiative coming out of Bloomberg in regard to the financial responsibility of company directors to their shareholders has become very apparent. And they no longer there's legal opinion in Australia now that they're legally and criminally liable if they do not include climate change in their reporting to their shareholders. A really interesting turning point in Australia because finance will do what the politicians haven't been doing. But I want to move on to the media. But one of the I've got a page of notes here. Hopefully I don't forget a couple of things, but I am going to concentrate on the media conference, if you like, how you actually behave to some degree. But I'm going to address the whole media cornucopia to some degree, because if you've left it to the media conference or the disasters to give people all the information that they need, too late. And it's far too late to try and put it all into that particular point of engagement. So coming back to the point about what you do when you actually get in front of a camera or want to communicate your message, it has to be really simple. So it has to be entertaining. That's what these people do, because they're in competition to gain the attention of the public so that people will come to them and it will pay money because their advertisers will earn money from people coming to them. So it has to grab their attention. It needs to be newsworthy. Of course, it needs to have information that's valuable. When you prepare, and it's like property, it's position. With media, it's planning, or preparation. No question. It is a profession. When you see something working really well on the telly, none of it's by accident. It's completely by design. So everything there is a professional performance. You have to understand that you are attempting to perform at that level, and there are some good gotchas, right? There are some things that you'd never, ever do. So, for instance, there is never an off-the-record comment. So it is a very important point, because the other thing the media love is a contest, or if you will, conflict. Because if you end up finding yourself talking about resources of your organisation, you are far gone. Because if things are hard back at the office and they find that moment of weakness where they just ask that question at the end of the conference, it could end up being the whole story and nothing to do with what you wanted to do. So there are some really dangerous places to go. And I'm sure this afternoon's training will probably expose some of that, because it's hard lessons, but you've got to learn them. I agree with the fact that very few or no numbers is the best way to go. I did want to share with you a really important way of thinking. Again, it's almost a sidebar. But what you're doing when you're in a disaster sort of situation is you're in an incident management scenario. So you need some incident management thinking. There's a really nice set of, I'm sure every country's got it, but we have the Australian Interagency Incident Management System. You can look it up on the web, AIIMS. And within it, there are roles for different people. So there are logistics officers, there are people with specialist technical knowledge managing the technical questions. There are people who are dedicated to media. There is someone dedicated to intelligence and someone to operations. And when you think about the breadth of those activities, leave them in the incident management team when you go to do the media. There's one thing that you want to do well, It's the media, not all the other bits of business. They stay back in the back office. So that's something you have to understand. You are there to entertain with information, and remember that it takes practice, and it's best if you have your own professional helping you. Don't be afraid to use the professionals to train with, to use them, to get better, because if you don't, you are winging it, and it's never good. It's never good. So one of the things you want to worry about is, what is tomorrow's headline? So if there's one thing that you say that is the thing that you want to say, you say it so clearly it can become the headline. If you get drawn to another topic, it becomes the headline, and sorry, you missed the opportunity. You do need to stay positive. You never leave people such that they feel like they're hopeless. You know, it's a hopeless situation. You may feel that it's a desperate place, but you have to find that way in which people will be able to find a response, an activity that they can do something positive. So even something to the point where it's okay for me to say, you really should ask about your parents or your elderly neighbour. It's okay for me as a weather person to say that. And I agree, you have to do it. You cannot resolve from your responsibility. You have to do it. I'll mention the idea also of developing your partnerships. So the Bureau, if I go back half a dozen years, we never did media conferences. We're kind of a really blue rinse thinking science organisation, and we never really got it in the beginning. We basically said we do our science, we poke it out the door, everyone will love it and they'll look after it, and they won't. But what we've found is that we will call media conferences now, and everyone comes. The shock, you know, in the beginning, they actually do want to come. We are a highly trusted organisation, so that's something that they really do want to come to us, and come to us frequently. One of our lessons about coping with the pressure is that in the past they would come to us singly, and we would find ourselves lining up all these people one after another to try and give them their message. And then they'd want us to colour it a particular way so they could differentiate themselves in the marketplace. When we became stronger and more coherent about what we were doing, we said, no, okay, we can't cope. We've got to do it once and do it well. They may choose to pool their resources and send one camera and share it amongst all the networks, or a journalist with a... And that's okay. Don't think they haven't turned up. You can ask them what they're doing, and they'll tell you. But if you get a sea of cameras, that's wonderful. Great opportunity to make sure your partners are there, the people that you're developing your relationships with. Make sure that you've let the health people know, you've let the emergency services know. It's probably enough. 3 people in front of a camera is pretty good. And you may stand in the cameras collectively for 10 minutes and see 5 seconds on the news that night. Don't worry, you won. It was good. It really did cut through. It was a story that rated, and it probably builds other stories that follow later. So that's really important. And the one thing that we do now quite a lot is that we do a lot of video news releases. It cuts out the middleman. But it's needed, and it appears in different ways within the media, so it's the multimedia choice. We do audio news releases. We obviously do the conferences. We do the... And my comment about politicians appearing within your team, it's really good. It's good. It's great because, you know, you'll find after a while, and you let it happen, because the media will have their political thing of the day, and they'll start asking that question. It's got nothing to do with the incident. You know, it's someone who's slept with someone or done some other amazing thing that you think, what's that got to do with an emergency, you know? So where I've seen it work best, because the police in South Australia, the Commissioner is the representative of the Premier, who's the head of the state. He constantly is keeping the Premier at a distance from the emergency team, but occasionally it gets so big, great, let him and the Premier go off and do a conference, and immediately after do your own conference. Because there's where the content is, that's a different story. Don't let them get mixed up if you can help it. Sometimes, yes, it will happen that way. If you get a very good professional politician, they'll know where the news is and they'll keep on handing it off. They just want to be there to keep on being seen. It's rare, but it does happen. And finally, be careful about choosing to do advocacy during an interview. It's not generally the right time to do it. In Australia, we're schooled incredibly by our conservative climate change agenda, where we have denialists that we have to be careful of, and it's a political scene. Stick to your knitting, make sure you're talking the story. What you know is the trusted news story. Let everyone else work it out. So if I get asked a question, for instance, at the end of the interview, is it climate change? Boy, is that a loaded question in Australia. So I will go to my knitting. I will say, this is an unusual event. It is a climate extreme, and we are seeing more of them. I'm not going to say those words. Let them work it out themselves. Thank you.
Thank you, John. And what you were talking about was a very useful technique, what we usually call bridging. So somebody, a journalist or somebody has come to ask you something to get you into trouble or get your boss into trouble, or and has an agenda, and that's not what you're there for, and it's not what your expertise is. So you don't say, oh, I don't know anything about that, or not. You don't engage. You take a step back and say, the interesting thing that we're going to discuss is blah, or you can take the end of the sentence if they've talked about something like, is it climate change, just as you said, there are important issues to consider, or something that doesn't say it's climate change, but you go into the science you do know. And bridging is a very good technique to learn, and that's another reason to get practice. Now, I'm going to throw it open to the room because we're running a bit short of time, and then I'll ask a couple of my own questions because I've got burning questions, but I'll let you all ask your questions first. Ah, yes, at the back. Yes, go ahead. That's you.
So our understanding of heat stroke has changed quite drastically in the last 5 to 8 years, and the information I think needs to be updated. In terms of the risks of particular individuals and the mechanisms of risks, they're very different to what is presented. So older individuals have age-related decrements in their ability to sweat. That's the main reason that older people get hotter during extreme heat events, not due to age-related decrements in thirst sensation. Obese individuals don't have a reduced capacity to dissipate heat in the heat. This is physiological evidence that's demonstrated this. So I'd really encourage people who are responsible for developing these heat health plans to collaborate with thermal physiologists or physiologists in general to make sure that this information is up to date and is informed by the latest literature, because I think we have lots to contribute from our physiology community. So it's a comment, not a question.
Another question or comment? Lucas.
Yeah, I have a question, Margaret, thanks. This is to all the panelists, really. I was actually wondering, how is it that we evidence the effectiveness of communications interventions when they're so reliant on the societal context that we use them in? So if we're moving towards an evidence base for communications and an evidence base for the effectiveness of these, then how do we do that?
going to ask Alex, because he showed us a lot of videos, and my question too was, how do you assess the impact of those? You've done a tremendous amount of work on it, but how can you be sure people are really getting the message you want them to get in their heads and taking action?
Well, the truth is that you can never really know exactly how much they need to know. What we can see is that we, from social media, we can, when we put out a video, and then we can see a lot of instant feedbacks from the comments. We can see how many people are watching the video, how many people are engaging, and how long they are watching the video. But well, the digital era, there is no way that we can put a test to them and, okay, how much you understand, there is no way to that. But from the feedback, we can see the people are, at least some of the people are getting to know more about the facts that they previously don't. And I think just a bit of a step is still progress.
Yes? Go ahead.
The other thing, though, that is emerging is the social sciences, and they are they're slow to emerge, but they are needed, and they are they're disciplined. They're often done with surveys and or focus groups, and they are legitimate within the literature. So those methods are emerging. We don't often use them often enough, but I think there is a stronger trend to use them now.
I was going to say the same thing. In fact, there is a much stronger trend. We are doing it a lot, and we rely very much on organisations like the Red Cross to collect feedback, and we're doing it systematically. I'm sorry that all I ever talk about is Ebola, but it's taking up 90% of my work at the moment because we've got a huge outbreak in Congo. And we now have Red Cross volunteers who collect systematically community feedback. Some of it simply comments. UNICEF does what's called CAP studies, which is knowledge, attitude, and practices studies. And all this data is then sent back to another partner, CDC, who are just fantastic analysts. They're not allowed into the part of Congo where this outbreak's going on because of security issues, because it's a very dangerous place. But they're in Atlanta analysing this, providing it back real time. We're getting it back in a week. So when I mentioned before that the Ebola posters weren't working, that was coming from the Red Cross volunteers who were talking to the community, sending it back to the CDC, analysing it, coming back. We change. So there is a mechanism. It's a very important mechanism because we do provide all these messages, all this stuff. If it's not hitting the spot, or if it's actually sending the wrong message, how do we know? Social media is great because it does give you a two-way feed, but be careful of, you've heard of fake news, there are also fake views. There are click farms out there. So an advertising agency that you've engaged to do your presentation, whatever, sticks it up on YouTube, and what they do is they pay for an advertisement that automatically pops up, and that's registered as a click. They've never looked at your thing. We had one recently, it was a really corny pop song, and we've made all these really good, we thought, educational videos, and the only thing that got huge, seemed to have huge engagement was this corny pop song on pollution. And it went from something to 100,000 views in 4 days. So we investigated. 80% of them were coming from Vietnam, but the pop song didn't have anybody Vietnamese in it, and it wasn't in Vietnamese language. And it was purely because the advertising agency that had developed this pop song had put an ad integrated it in the song when it went up on YouTube, and what we were seeing were totally fake views. Nobody was watching it. There are ways to find out. You look at the comments under your thing. So if you're getting a lot of comments, you're getting a lot of debate, you've engaged. But if it's just views, same with impressions. Impressions just means it went to somebody's Twitter. What matters is retweets, because somebody looked at it and said, I want all my friends to know this. And likewise with Facebook. So again, it looks great when somebody sends you the data, but you need people who really understand what this is about. And one of the real traps with social media, it's very, very good, easy it's very easy to fake success. You need much more stuff on the ground. I think Candy's... Oh, Alex and Candy, it's lighting up.
Just to add that, I totally agree that if we are we're trying to pay the agencies to do the advertisements for us, and absolutely, yes, there's a big trap and there are a lot of fake views, a fake reach. So what our strategy is that we try not to use so much ads. We basically be over 90 or 95% of our posts are all organic. So we try to do the better content to attract the audience. That's all.
I very agree with Margaret, and that's why in the Red Cross family, we have a very comprehensive system when we design our service and do the evaluation. The two examples that I just mentioned in my speech, like the visit with the elderly people or subdivided flat, we do, when we visit them, before we visit them, we have sort of a briefing with them and also with the partner organization. So we have a number of activities like to prepare some carnival to make them fun to learn, and then we have some education materials, visit them many times in different periods, and then we do the questionnaire and survey. Some of them may not know how to take those surveys, but through our volunteer, we explain to them. So we get a pre and pros result. This is very encouraging because we find that the knowledge, and as I said, how to put the knowledge into practice. And sometimes we will, through the little games, to test whether they really understand and know what to do in case of an emergency. And the result is quite good. Normally, we got over 50% of the increase in their mindset and how to do the action. And it is also a good evaluation tool for our services as well, to see which area we need to strengthen, which area we need to make adjustment. So I think this is a very important to have the cycle, the whole cycle as a loop, in order to ensure what we disseminate is really can be digested and then used by the people in need. Thank
you. Facebook in the Bureau is very new, and it's been very interesting. Dawn or sunset photos, people posting them is a honeypot. People want to put them up all the time. You need to find out what in your sector people want to share, and you'll be surprised. If you find the right thing, it will actually make the site work, and then you have the information sitting there beside it, and you know you're getting through because those things that are important, they recognise them and they share them. So you have to have ways of leveraging your site.
That's a really good point, and I think Alex was making that earlier, that you have something that's attractive to drive traffic to come and read your other information. And, oh, Sarina's got a question.
My question is how to communicate with people who are not naturally receptive to the communication. Specifically, I'm interested in people in business or entrepreneurs who are not naturally interested in climate change or disaster risk management related to health. And the other group are the people who work in this field, in disaster risk management, but who work in silos. Like, for example, people in health emergencies, outbreaks. How do you get them to start talking about climate change in an all-hazard manner?
I think I'll start with Jason, then I'll ask Dr. Chow, because I think you've got the disaster risk management hat.
I don't know if this is, yeah, it is working. What I found, my special area of interest more recently is in antimicrobial resistance. And this is something that a lot of pharmaceutical companies and food companies have pretty much ignored. But major shareholders, investment companies are grouping together and are putting it on the agenda. So I think the investor community, who really do have a much deeper and a huge amount of economic clout, are now saying, we want to know what you're doing to mitigate the risk of, in this case, antimicrobial resistance. But I think, as we just learned from John, climate change.
For our organization, the Disaster Preparedness and Response Institute, one of the experiences talking with the Hong Kong Jockey Club, we just showed the importance of having a single platform, a multidisciplinary, multi-collaborative, participative kind of mechanism involving people dealing with the preparedness and response, and to present to them the importance of this in Hong Kong and locally, and hoping to expand to internationally, and highlight the gaps that at that time Hong Kong do not have this organization. And so these are the sexy points that I think Hong Kong Jockey Club get into and then funded the organization. Then for the other collaborators involved in disaster risks, through the medical community, the Hong Kong Academy of Medicine, we usually highlight the topical issues with knowledge and sharing with the controversies, and hopefully we can build on the consensus information across the different specialties of the medicine. And hopefully we can, after building the consensus statements, we can use these consensus statements to spread this information to the general public or to our patients.
Hello. I think it is very important to find common ground, no matter we are talking to the business people, government officials, or even partnering NGOs, because I think each organization must have its own mission or values, and it is important to get this right, as I mentioned in the message. I just quote an example. We are going to launch our disaster prepared truck next year. And it is a big move of Hong Kong Red Cross. So far in Hong Kong, there is not a real disaster preparedness promoting truck which can move around to different places. So we came up with this idea with a lot of collaboration with different parties. And then we need to get the funding. So as you mentioned, we need to approach different business entity to talk about them. And of course, since it is such a new idea and the commitment is not small. When you're talking about the truck and then the design, what we want is to have a real experiential when it is really get fire or hit. Once you feel it, of course this is through a game, but you need to make it real in order to make people scared and feel that there is a need for them to do some preparation and prevention. So we approach different company, and of course you need to match with the company business. We find a common ground and then to try to make a win-win situation. That means we can have their support to do what we want for the community, and they can use it as their corporate social service. And so it's not easy, but I think the right direction is find a common ground and try to make a win-win situation.
So maybe it's about understanding the governance structures that work within, and having the person that understands that governance structure, and that's your key partner. So in business, I'm not an expert, so I need help to find that, and I won't necessarily know who to go to, but it might be a Chamber of Commerce, it might be something else, I don't know. But in government, I know a lot, and so I have a key strategic partner in the state that I work in, and he has the hazard responsibility. He surprised me in our last major heatwave. I got a message from my national director in Melbourne saying, I've got this letter here, you need to read it. What are you doing over there? It was very odd because the Chief Officer for the Emergency Services had written to the Attorney General of Australia requesting that the Commonwealth, you know, not the state, but the Commonwealth, made sure that all of their employees were safe and called for all of our officers to be offered as cooling refuges if someone was in distress. So I was surprised, you know, and the thing is sometimes your partners will surprise you when they get it. So the thing is, that person knew the governance structure and what to do, who to touch to make a change. So in government I know what to do, in business I don't, I need to find the partners.
That's really good advice. Who to touch to make a change. I think there was a question over here first of all and then you. Yeah. No? We've got, okay, last two questions. I'm being told to wrap up. Yeah?
Thank you. I'm Andreas from the German Meteorological Service. We are responsible for the heat health warning system in Germany. And we released this year 6,000 warnings about heat on county level. And so my question to you is how we deal with the situation. We release a warning, but the catastrophe will not take place. This is for me a problem, not only for the media, but also on the video level, because I got an email from someone who is one of the very important person in Germany, was about 3 pages long, telling me that the things that I'm telling to the people, that you can modify your working times, working early in the morning because there's advice, and ending the work about midday, and he said the industry will collapse. So how we deal with that kind of situations?
It's an opportunity. You've got a person there who wants to become a partner. So you bring them in and you work together on actually designing it, what will help. So I don't have a solution, but you've got a partner there that wants to work with you.
Well, I think false alarms are always the nightmare for all the national weather services. For us, when there are times that we also have false alarm on typhoons, one of the most severe hazards in Hong Kong. What we try to do is that before and during and after, we try as much to communicate the forecast uncertainty as possible, to tell them why we are making this forecast, because we tell them there are different scenarios, why we think that this is the most likely one, and that's why we are making the decision before that, during that, and after that.
Yeah. This is exactly what I want to mention about the post-heat wave or post-processing, that we need to communicate that also.
So is it possible that the communication that you've given, for example, the media, and they have disseminated and people have responded to, has mitigated the impact, and therefore the catastrophe has been averted thanks to the information that you've provided?
This is the reason, because we have the system we want to avoid.
Yeah, it's working.
Yes, it's working. we don't want to release a warning, but we have to release a warning.
So are you saying you're a victim of your own success?
Yeah.
I'll ask last question over here. Yeah.
Thank you. For me, it's not a question really, but perhaps I thought it would be of interest to share some of our UK perspective from our Met Office and National Met Service. And what we found on the business side of things, actually, Mark Carney, who's the governor of the Bank of England, he's very interested in climate change. And in fact, he delivered a speech in 2015 to the banking authorities. And he made a point about the risk of climate change within the financial stability context, particularly in terms of emerging catastrophic events. And that really grabbed all the headlines. And all of a sudden, he came to visit us. The chief scientist was very involved with him. And in fact, we set up a small group to look into financial resilience. And it worked for us. I think we leveraged each other's credibility. Worked really well, and then it backfired for other reasons. But partly, it was very important, I think, to make sure that it was two organizations that are very close to the public for various reasons. The other thing that we found it worked for us is that when we release alerts, so we do it from a meteorological perspective and bring the health specialist, Public Health England, to make comments on the health aspects of it. And then on their website, Public Health England actually bring their perspective from the chief meteorological forecaster. And yet again, is leveraging, if you like, that credibility that we bring to the table. So the Met Office doesn't say anything about public health, and Public Health England doesn't say anything about meteorological, phenomenon, if you like. And I'd like to add a couple of more things, if I may. We work a lot with the public, and actually we've invited them to name storms, and that was hugely popular. And also to use their mobile phones and any way of bringing their observations that a lot of people not only gather through the phones, but through anemometers and things like that they have in the gardens. And that contributes to the verification of our forecasts, so they feel that they are part of it. And we also partner with, for instance, in the case of pollen alerts that we sent out, with asthma experts, NGOs, charities, even pharmaceutical providers of certain types of popular medications and so on. And yet again, we leverage it from each other, really. And finally, we run science camps, and what those are is basically we bring children from the ages of 10 to 15 for a weekend at the Met Office. They pitch their tents in our grounds, and we give them a little bit of a grand tour of not only our facilities. The supercomputer is always very popular, but also we have mock-ups so that they can present the weather, and they also can engage in what the weather means for various different sectors. So we work not only with health experts, but with transport and some things that they can relate to. And that seems to work really, really well in our case. So everybody who comes across, Met Office employees regardless, always kind of are very interested in interacting with us. And I think it's because we do put a lot of effort. We've got a team of over 50 people who dedicate time, from people like me to people who are forecasters, to people who have been deployed in the ground, for instance, at various international airports in Camp Bastion, which is the British airfield in Helmand province. So we bring some color, perhaps, in that respect, and color that most people won't think we have. Everybody they were very service some time ago that thought we as meteorologists or oceanographers or whatever we were rather dull, and all of a sudden they realized that there's an extra dimension there. So yeah, I just thought I'll add that. Thank you.
Thank you. That was a very good wrap-up of how to leverage partnerships, build trust, engage your community. You really had all the communication aspects there. So thank you. You gave a fantastic summary of what we need to do. I've been told to wrap up, so I've got a lot of questions for the panel. I would like to ask you all, but we'll do it by email, what you think GIN should be doing, where you think we can change or improve communication of heat health. What do you think we should actually be doing and improving? But I'll ask you those questions by email, so some homework for you and for everybody else if you want to contribute. Thank you so much. I have learned an enormous amount today. I hope everybody else did too. And I'll now let you all have coffee. And thank you so much to the panel. Brilliant panel.